Trying to connect.
Hi, good morning everybody. I'm Stephen Fine, one of the physicians here, and we're streaming for you live from the Jordan Health Center. This program is sponsored by Clinical Education Initiative, which is part of the New York State Health Department, and our goal today is to destigmatize HIV testing. You have probably heard by now that everybody is encouraged to get an HIV test. We're hoping that this program may reach people who are thinking about getting a test, who have not been tested before, and perhaps are anxious about the test. And so what we're going to do is actually a live test right here on the air and show you what it's like. And hopefully that would encourage people to come in and do it. During the show, go ahead and ask questions. We'll be receiving your questions and answering them. But try to remember that this is Facebook, and anything you put out there will be public. So don't write anything that you wouldn't want out in public for this show. Just a minute, I'm going to ask Ryan, who's our registered nurse here at Jordan Health Center, to go ahead and start the test. Why don't you ask Ryan to come in? Okay, thanks Ryan.
Yeah, no problem. Good morning, everybody. My name is Ryan. I'm actually a registered nurse at the Jordan Health Center. I've been here for about 10 years this month, and I am a good resource, and I test patients for HIV on a daily basis. I'm actually probably one of the lead nurses who actually has the most tests done over the period of 10 years. So I probably got almost under 2,000 to 3,000 tests under my belt. So what brings you in to be tested for HIV today?
Well, I just started a new relationship, and we figured that we would both get tested.
Okay, did he ask you to get tested, or you want to get tested?
Well, I want to get tested, but I figure if I'm going to say to him, show me yours, then I have to be able to show him mine.
Okay, have you ever been tested before?
A long time ago.
Okay. Do you know what kind of test did you have? Did you have the one where they swabbed your mouth, where they took it from your arm?
They took it from my arm.
Okay, so the one we do today, we actually use the 4th generation. It's actually a little poke on the finger. You'll know your results in 20 minutes.
Okay.
It's actually the latest and greatest, I like to call it, because there's a new thing that's called the P24 antigen. It can actually detect HIV, screen for HIV as soon as 14 to 17 days now.
Oh.
So New York State requires us to ask that we do need consent, so if I get your verbal permission, I can actually perform the test today.
Yeah.
Okay. So which finger is the good one? So can you tell me what you know about HIV, what you've learned in the past?
Well, they told me that it was an infection that got passed through sex. Okay. And that you can't tell if somebody has it by looking at them, so you have to do a test. And that's about all.
Okay. What part of sex do you contract HIV? What was the most part do you think comes from? Does it come from kissing, from blood, from bodily fluids?
Tell me, remind me again.
Okay. Most transmission is usually from the blood or bodily fluids, which is the semen in men and also the vaginal secretions in women. And for males who have sex with males, it also comes through anal sex as well. Can it be passed if you're wearing a condom?
I don't think so.
It actually decreases the chance. If you're actually wearing protection, there's actually a 99% chance you cannot contract it. Can you get HIV from sharing a needle with somebody?
If I shared needles, yeah.
Okay. If your grandmother's sexually active, do you think she can contract HIV?
Well, old people don't get HIV, do they?
Yeah, they can. If they're sexually active, they're not wearing protection, and they have more than one partner, yeah. HIV doesn't discriminate.
Wow. So now what?
So what I'm going to do, this actually has to go under by a timer. This is, when I say this is a good screening tool that we like to use, it's the most valid. I'm actually going to have the specialist, Dr. Fine, actually come in and talk to you, give you a little bit more education, and we'll go from there. be back in with your results.
How long does it take?
It takes 20 minutes.
Okay.
I know it's going to be the longest part of your life, but I always like to say, I haven't had one positive test this year, and we're going to keep it that way. Okay. Okay. Let Dr. Fine hook it in.
Thanks, Ryan. And that's all there is to it. Did it hurt?
No,
See,
not at all.
that's great.
Feels good.
It hurts a little bit, I think, when I've had it. That's just a finger prick, though. One of the things that's important to know about HIV testing is we really do this as part of routine medical care. You don't have to come in specifically for an HIV test in order to have it done. Most of our patients who are getting their HIV tests are getting it done when they come in to see their regular doctor's office. So after the test is drawn, they might wait in the waiting room and go in and see the doctor and then get the results for the test at the end of the visit. I think Ryan pretty much told you the important things that we're required to tell people about HIV testing, in that HIV is a sexually transmitted disease. It is also bloodborne and can be transmitted by sharing needles. I think he also mentioned that it's illegal to discriminate against people with HIV, at least here in New York State and most other states in the United States. If you have HIV, you're protected against discrimination, and you can't be denied housing or education or any of the other services that the state provides, or anybody else, just based on your HIV status. And that the consent used to be a written consent, but as you just did, it's really now a verbal consent. And all we have to do is ask you and then document somewhere that you did agree to be tested. We offer these tests on an opt-out basis. What that means is when you come in for regular medical care, we generally include an HIV test along with your regular blood work. And if you don't want the test, you let us know. We always offer the option of not having the test done. Are you nervous?
A little bit, but I have a question. What happens, like, if my GYN wants to know the results of the test? Do you just give them out to anybody?
If you're in regular medical care, the information can be transmitted as part of your medical record only to other medical professionals who are specifically caring for you, and only if you give specific consent.
Okay.
So when you sign the HIPAA form in order to send your medical information to another doctor, you actually have to check a specific box for HIV-related information, mental health information. Also goes along with that. I know I was pretty anxious when I first got my HIV test done years ago, after having been exposed as a medical student to needle sticks and various patients' blood during surgeries and stuff. But that was back when HIV was a dangerous, much more dangerous disease, and the treatments were a lot more difficult and ineffective. I don't think I would be very anxious getting an HIV test nowadays, because I think that the treatments are so much better that we had before. For example, if you were to test positive, I would probably tell you, I have a set list of things that I tell people who have HIV that they probably don't already know. The first one is really interesting. People who are HIV positive, who take medicine for HIV and are able to obtain a viral load of undetectable, that means the medicine is working and they're generally taking it every day, live just about as long as people without HIV. So if you control for other things like smoking and other dangerous behavior, being HIV positive doesn't actually shorten your lifespan at all.
So people don't die from it anymore the way they used to?
Almost never, as long as they're taking their medicine. People who are HIV positive who take their medicine generally don't get sick from it. They live just about as healthy as anybody else. Perhaps even more healthy, because we do require them to come see the doctor a couple times a year, and oftentimes we do other routine screenings and vaccinations and things that lead to an improvement over people who are HIV negative. People with HIV nowadays look like everybody else. I heard you mention you can't tell who has HIV just by looking at them. Back in the old days, 10, 15 years ago, some of the medications that we used for HIV actually caused people's appearance to change a little bit. They would have thinner faces and perhaps gain fat in places that were not normal. So you could identify people by looking at them. Nowadays, that's not the case. None of our treatments do that. We have a sign up here. I don't know if you can see it on the screen, U equals U. That stands for undetectable equals untransmittable. That's actually one of the newest campaigns that we're doing. And what it is that people who are HIV positive on medicine actually can't infect anybody else. The medicine is so effective at suppressing the virus that now, even if they have unsafe sex, unprotected, they can't infect their partners. That gives people some confidence, I think, who are HIV positive. Most people who are HIV positive can have families, can plan for children and whatever, just as if they're HIV negative. We'll talk to people about that, but taking medicine for HIV completely prevents your children from getting it and from infecting your partner when you're trying to have children. So family planning is not actually affected at all. And then most people with HIV take one single pill once a day. And I have brought this just in case people were interested in seeing. The recommended regimen for people who are HIV positive are varied. There are several of them in this little pill case, but most people can take one single pill once a day. And these pills don't even cause any side effects. In fact, I'll guarantee it, if you have any side effect from your medication, we'll change it to something that won't cause a side effect. And then finally, most people are covered under health care. And while we're waiting, I actually thought I would have one of the social workers stop in just to let you know what's available if you did test HIV positive as far as what the state goes. And I'll turn it over to Yolanda in just a second, because my last point is, and I'm very confident in this, although I have no proof, you will be cured of HIV in your lifetime. People are very actively working on curing HIV, and I believe that no matter what the results of your test today, even if you have to go on medication for a time, you'll eventually cure this disease. So what would happen? Yolanda's here. What would you tell somebody who is HIV positive?
My name's Yolanda. I've been at this agency for about 18 years now. And when I meet a patient, I usually explain to them what my role is. And I would explain to them that I would try to assist them in their needs, and that I am very familiar with other agencies. Certain needs that come up frequently are housing, transportation, insurance, and we can talk about that a little bit. There's something called ADAP, where if you don't have any type of insurance, ADAP I can obtain pretty quickly. In 2 days I can get the ADAP running, because usually Medicaid takes longer than that. I can link people up with outside agencies that can assist them with the housing, can assist them with their transportation, whether it's bus passes, whether it's Medicare. Do you have any questions for me?
So if my insurance company sees that I got tested, are they going to increase my premiums?
No, they're not going to do that. If you have Medicaid, usually the Medicaid will cover medications and their visits and their blood work. So that's something you don't need to be concerned about.
Okay.
But again, if you don't have any type of insurance, we can always apply for the ADAP, which is the turnaround time can be maybe 2 days. And if you need your medications, you can get that.
Okay, all right, that sounds good.
Right. And there's also other agencies where we can get support for patients that need to meet other people that can talk about what they've been through, and that's something that you might be interested in. It's also helpful
Okay.
in the future.
Okay.
Do you have any other questions for me?
I don't. I guess I'm just nervous about getting the test result back.
Well, in this agency, we have a team that can help you. We have a behavioral health team. We have a med adherence team. We have bilingual services here as well. So that if that's something that we have a Spanish-speaking person, I will be available. And there's also other services here that can assist with that. So, si alguien allá afuera habla español, yo soy una trabajadora social y yo puedo asistir en tratar de ustedes entender y comunicar más mejor. Any other questions?
I don't.
No? Okay.
Thank you. So it sounds like you'll be in good shape, whether we test negative or positive, with insurance. And I should have made it clear earlier, we actually are trying to get people onto treatment within a day or two of their getting diagnosed. There are places around that are experimenting with the idea of starting treatment the same day that you have a positive HIV test. The benefits of treatment are so good that we're doing that. We have a question.
Yes, we do. What is the very first line of treatment if positive?
It's a great question. However, we still use a combination of medications. Currently, we like to use at least 3 different meds for HIV. However, they're all combined into single pills. The pills that I showed earlier, these are actually all recommended treatments for first-line HIV patients. What we would do is choose the treatment based on what's best for the person. Some of these pills do require you to take it with a meal, others don't. So people who have a very chaotic schedule may wish to take a pill that doesn't take it. I won't name them all because I think that would get boring, but the first line of treatment is 1 pill once a day for almost all patients these days.
Another question, can I just walk in and request an HIV test, or do I need to have an appointment?
Absolutely, just walk in. HIV tests can be done as part of your routine medical care when you go to the doctor, an emergency room, an urgent care, a public health center like this. And if you look up HIV testing online, wherever you live, you'll find many, many locations that just have walk-in testing. We have ours. Sometimes we even come to you. So we'll go out and do testing at health fairs, clubs, bars, other places as well. So absolutely you don't need an appointment, just come on in. Still waiting for some questions out there. Any, one thing people a lot of times wonder is what happens if they test negative? What does that actually mean? And as Ryan mentioned earlier, we're doing a 4th generation HIV test, which tests for both antibody, which is the substance you produce in your body to try to fight off the HIV, and antigen, which is actually a protein that the virus makes. The beauty of the antigen is the virus will make that earlier, before the antibody is up. And from the time you're HIV infected to the time the test goes positive can be as little as 2 weeks, sometimes even a little shorter. We still tell people that it's as long as 3 to 4 weeks. So if you've had any risk of exposure to HIV in the last 3 to 4 weeks, we would ask you to come back and get tested again if your test is negative. However, for the most part, unless you're in that window period and you've had some exposure within the last 3 weeks, we would tell you a negative test is negative.
Okay.
Then we would talk about PrEP. PrEP is an acronym for pre-exposure prophylaxis, and a lot of people still don't know this. There's actually a medicine you can take if you're HIV negative that can protect you from getting HIV. It's a single pill. It's called Truvada, and it actually consists of 2 medicines that are designed for HIV. But people who test negative, who may have some sort of risk for HIV, are very much encouraged to talk to one of our doctors here, one of our nurses, or their own clinician.
Does it really work?
It really works. If you take PrEP, there's almost no chance that you'll actually get HIV. In fact, if you do, you can still be written up and presented at a conference, because it's very rare.
Another question. So if negative, how often or how long should I wait to have the HIV test repeated?
That's another great question. So if you're negative, and you're still engaging in some behavior that might expose you to HIV, and that can be anything. That could be sharing needles, that could be any sort of unprotected sex with somebody who could have HIV. We generally recommend getting tested in about 3 months. If your exposures are fewer and farther between, maybe once every 6 months or once every year would be enough. But we always recommend that people come back in about 3 months to get tested again. If you're in that window period when you're tested and you had something that you really think might have caused you to be exposed to HIV, then we might recommend coming back in just 1 more month, because it only takes a month at the most for these tests to turn positive. Thanks for the great questions. If there's no last minute ones, I think we're going to wrap it up. We now know what would happen if you tested positive. We now know what would happen if you tested negative. And we're just about out of time before we see the results of your actual test.